Chapter 6, Misuse of Barbiturates and Barbital-like compounds. So this is still a concept of chemical dependency. So, introduction. Anxiety disorders are collectively the most common form of mental illness in the United States, affecting almost 34% of people at some point. As many as 22% of people struggle with insomnia. Both of these problems have been addressed with barbiturates in the past. Early medical treatment of anxiety and insomnia, 1 of 4. Chloral hydrate, effective hypnotic, first marketed in 1870. Side effects, irritating and stomach lining, quite addictive. Withdrawal after extended periods of use can result in life-threatening seizures. Alters biotransformation of other drugs. Halolide, first used as a hypnotic in 1882, produces little cardiac or respiratory depression. Side effects, produce a noxious taste in the user's mouth. Narrow therapeutic window, between 70 and 80% leaves the body unchanged. The bromide salts, introduction in the mid-1800s, currently not used with humans in the United States. Originally used to treat epilepsy, and later as sedative and hypnotic. Side effects after a few days' use led to drug-induced depressions. Narrow therapeutic window and withdrawal can be unpleasant. So early medical treatment for diphenhydramine, antihistamine with strong sedative effects, commonly recognized as Benadryl. Overuse can lead to delirium in older adults. History and current medical uses of barbiturates. First, barbital, introduced in 1903, originally thought to be non-addictive, primary sedative hypnotic, until development of benzodiazepines. Still has medical uses, but reducing in use. Also used in lethal injection for death penalty. Pharmacology of barbiturates. All are CNS depressants and share same mechanisms. Inhibit closing of the GABA channels in neuron walls. All have low therapeutic windows, classified on the basis of their duration of action: ultra short, short acting, intermediate duration, and long acting. Pharmacology of barbiturates, 2 of 3. Clinical applications of them. So you have the ultra short acting ones, which when injected effects begin in seconds and last for up to 30 minutes or less. Very lipid soluble, useful in dental surgery. Short acting ones, usually administered orally. Effects begin in 10 to 20 minutes and last for 3 to 4 hours. Elimination half-life may be longer than duration of effects. Lipid soluble falls between that of ultra short acting and intermediate durations. Intermediate durations, usually administered orally, effects begin in approximately 1 hour. Effects of a single dose last for 6 to 8 hours. Elimination half-life may be longer than duration of effect. Moderately lipid soluble. And then long-acting ones, usually administered orally. Effects of a single dose begin in about an hour and last for 6 to 12 hours. Elimination half-life may be longer than duration of effect. Lipid soluble less than that of intermediate duration. So, pharmacology of barbiturates. Short term are almost fully biotransformed by the liver before being excreted from the body. Long terms are eliminated from the body, essentially unchanged. Subjective effects of barbiturates at normal levels. Barbiturates. At therapeutic doses, users experience relaxation or a sense of euphoria. Slightly higher dose can induce sleep. Effects are similar effects to alcohol. Complication of barbiturates use at normal dosage level. Paradoxical rage reactions. Tolerance develops quickly, but lethal dose does not change. Suppresses REM sleep in progression of sleep stages. REM Rebound can cause hangover effect, which may last past therapeutic effect. Reduction libido and intensification of ADHD symptoms. Effects of barbiturates at above normal dosage levels. Slurred speech and ataxia, respiratory symptoms and risk of pneumonia, bronchitis, hypothermia, reduced reflexes, toxicity, hypotension, coma, and possible death. Neuroadaptation, tolerance, and physical dependence. Neuroadaptation tolerance begin over a surprising short period of time. Increased doses to overcome this is extremely dangerous. Cross-tolerance with alcohol is dangerous as well. Withdrawal is potentially life-threatening. Longer-acting barbiturates will tend to have longer withdrawal periods. The barbiturates-like drugs. As dangers become apparent, new drugs with varying chemical similarities were developed to be as effective, but with reduced potential for addiction. So Glutethimide Meprobamate and Methaqualone. Anyway, I know I probably butchered some of the names of these, but thanks for listening.